Edema. What is edema? This is a condition of abnormally large fluid volume in the circulatory system or in tissues between the body cells' interstitial spaces. This is important because excess water retention as it relates to the feet and ankles may be caused by a number of factors, and it is very important to know the cause of this condition before it can be properly treated. Water retention in the feet, ankles, and lower leg is usually described as swelling where the foot appears bloated. The skin is therefore stretched and in some cases can be shiny as a result. With this swelling, there will also be a loss of visual skin structures like the tendons on the top of the foot. What causes edema in the foot and ankle? Swelling occurring in both feet is caused by 1. Venous insufficiency, probably the most common cause, where the valves that pump blood back up to the heart become incompetent over time. By the end of the day, the feet and ankles will be swollen, but upon arising in the morning, there is usually minimal to no edema. 2. Excessive humidity, this too will be worse at the end of the day and much improved first thing in the morning. 3. Standing too long without much movement. 4. Sitting too long where there is too much pressure on the veins in the back of the thigh. More common in the elderly. 5. Congestive heart failure. 6. Lung disease. 7. Kidney disease. 8. Thyroid. 9. Pregnancy. 10. People with salt sensitivity. 11. Medications including vasodilators which act to open up arteries, which bring more blood down to the extremities, calcium channel blockers which are used for high blood pressure, estrogens and NSAIDs such as Aleve, Motrin or Advil along with the prescription versions, all may cause excess water retention. This is particularly true in older individuals. Swelling occurring on only one foot. 1. Usually not from a systemic illness or from medication. 2. Trauma to the foot or ankle. 3. Arthritic flare-up of a joint which will usually mean a localized swelling in the foot or ankle. 4. Deep venous thrombosis, DVT, which most likely is occurring in the calf. This is potentially the most dangerous cause of unilateral swelling and needs immediate medical attention. 5. Gout, which is classified as an arthritic flare-up, will cause localized swelling. 6. Infection in the foot may also cause localized swelling. 7. Foot and ankle surgery will also cause swelling. After surgery, it is normal for the foot to swell as the body is increasing the blood flow to the surgical site in an effort to facilitate healing. Treatment for edema. The earlier treatment is initiated for this condition, the better the chances of eliminating it or at least controlling it. Treatment. 1. Identify and control the underlying cause and not just treat the symptoms. 2. Diuretics or water pills which help the body eliminate the excess fluid. 3. Elevation of the feet, usually reserved for simple cases of swelling. 4. Walking, which will force the leg muscles to contract and help return the blood to the heart. 5. Compression stockings, which come in various pressure gradients and help prevent fluid build-up. They need to be applied first thing in the morning. 6. Compression pumps, which are usually reserved for severe swelling like lymphedema in chronically ill patients. 7. Drainage of a localized abscess will reduce swelling in infections. Read the complete article at www.FOT-PAIN-EXPLAINED.com/edema.html